Hi, this is Dr. Mogga, paying homage to Dr. Barlow for starting this teaching sessions on TikTok. In my course, Peri-Operative Medicine for the Public 101, this is chapter 2, we will be talking about NPO Guidelines. NPO means nil per os in Latin, which refers to nothing by mouth, which are fasting guidelines that have been established by the American Society of Anesthesiology. Why should you be fasting prior to surgery? Fasting prior to surgery is recommended to decrease the risk of aspiration. Aspiration is food contents going into your lungs. There is a particular period of time between when we completely relax the patient and we secure the airway, and also a time when the breathing tube is removed. During these two periods of times, the patient does not have control of their airway reflexes.
So aspiration, what is the big deal? Aspiration is inhalation of food contents into the trachea, into the lungs. Aspiration is dangerous. Lungs are designed for air, not food. If stomach contents, which contains acid, enter into the lungs, it can cause a severe inflammation of lung tissue. Stomach contents also have bacteria, and that bacteria can cause an infection, and this is all called an aspiration pneumonia. Up on the screen is a normal chest x-ray of an 83-year-old patient. Now, 1 day later, the same patient's x-ray shows dense consolidations, which is actually from aspiration. This patient now has pneumonia. In this case, this was due to a stroke, causing loss of airway reflexes.
The guidelines are as follows. For heavy meals, it's recommended that you fast for 8 hours prior to surgery. For light meals, what are those? Something like a toast, something that does not include any fatty food, acidic food, heavy meal. The guidelines are 6 hours of fasting prior to surgery. Formula for infants, 6 hours prior to surgery. Breast milk, fasting for breast milk, 4 hours prior to surgery. And this is because breast milk has proteins and fats that are more easily digestible than formula made from animal milk. Clear liquids, 2 hours prior to surgery. What are clear liquids? Something you can see through, such as apple juice, prune juice, basically something without particulate matter. Okay, black tea, that's a clear liquid. Black coffee, that's a clear liquid. That does not include coffee with milk or coffee with cream. That becomes a light meal. NPO guidelines are frequently adjusted for patients who are diabetic, who may need a longer period of time to clear food because of delayed gastric emptying because of diabetes, patients who are obese, and patients who have other comorbidities. NPO guidelines, the anesthesiologist may choose to make exceptions based on the risk factors between waiting for the complete NPO guidelines or proceeding with your surgery. For example, when you have an emergency that must proceed immediately, usually check with your provider about the NPO guidelines for your surgery. In general, for most elective surgeries, you will be told to eat nothing by mouth. And as I mentioned in chapter 1, this is because if there are, for instance, 5 cases scheduled for one, if one person does not show up or 2 people do not show up, then the third person on the list is moved up. And that's why you need to be NPO by mouth past midnight.